So, what's your Oreo personality? How do you like to eat your Oreo cookies? I'll tell you, I am a separator. So, I like to twist mine and then kind of eat the cream out of the center. Uh, and let's see, am I curious? I am super, super curious, right? So, I guess that describes me. How about you? How do you like to eat your Oreos? You've probably seen things like this before, or perhaps something like this on BuzzFeed. But in reality, I mean, these tests are lacking what a good personality test, or really what any good test has to have. These tests are not reliable. They're not valid. Obviously these BuzzFeed quizzes are not scientifically created. And oftentimes, look at the results that they're going to give us. You got a good person, right? The quiz has determined you're a good person. You might have the occasional slip into bad personness, but overall you're pretty good. Doesn't that describe literally everyone? First of all, we haven't even operationally defined what it means to be a good or bad person. But then in getting your result, these results can be applied to pretty much anybody. This is something called the Barnum effect or the Forer effect, named for P.T. Barnum. Perhaps you've seen The Greatest Showman and you know who P.T. Barnum was, but he was quoted as saying there's a sucker born every minute. And essentially, this is what happens when we open up a fortune cookie, right? Or, sometimes when we do one of those goofy BuzzFeed quizzes or whatever, and we get results and we assume that, like, oh my gosh, they must be correct because they describe me so well. But the reality is, we have this tendency to accept information as true, even when the information is so vague that it could apply to literally anyone who reads it. So, there are problems inherent in trying to assess someone's personality. We've got to be really, really careful. And tests, just like we learned about earlier in the year, have to be both valid and reliable. They have to measure personality, if that's what they're setting out to measure, and they have to yield consistent results over time. So somebody has to be able to take that test today and take it in 6 months or a year and get pretty much the same results, right? We want high test retest reliability. So what are some different ways that we measure personality? Well, we can use case studies, but remember, case study, we're usually just studying one person, right? Or one small group of people that has a unique set of characteristics. We can do surveys. We can give personality inventories, like we're going to talk about in a second. These are objective tests that typically are standardized and they're scored using a computer. And then there are projective tests that we'll learn about as well, but those are subjective and they usually rely on someone else, not a computer, interpreting an individual's results. So let's talk about personality inventories and objective tests first. And the first one that I want to talk about is the Minnesota Multiphasic Personality Inventory, or the MMPI-2, as it is much more commonly known, because who wants to memorize all of the, everything I just said. So the MMPI-2 assesses for abnormal personality tendencies. It assesses for mental illness. Okay, so it's not assessing for the types of traits that we learned about in the Big Five. This test is looking to see if an individual might be experiencing behaviors and mental processes that are characteristic of depression or anxiety or schizophrenia or bipolar disorder. But an interesting thing about this test is that it does have a built-in lie scale, so to speak. So in other words, there's measures built into this test that assesses people's responses kind of to make sure that there's consistency in the way that they're responding and they're not kind of making up or purposefully lying. The questions are empirically derived, meaning they come from a larger pool of questions that have been given to individuals who experience depression, schizophrenia, illness, anxiety disorder, so that we can see if the person taking it is exhibiting the same characteristics as individuals who have been diagnosed with those disorders. Here are examples of some of the items that you would see on the MMPI-2. Okay, so a question that is looking to assess whether or not an individual is experiencing depression might say, I wish I were as happy as others appear to be. Okay, so again, this is assessing this. The clinical scale here is the scale that we're looking to see, is a person exhibiting depressive symptoms? The content we're looking for is, are they experiencing unhappiness and feelings of low self-worth? Another example might be of an item that might be on this assessment is, I have had some rather bizarre experiences. That is assessing on the clinical scale of schizophrenia to see if an individual might be having disturbances in their thinking, their mood, behavior. Are they experiencing hallucinations or delusions that might be characteristic of schizophrenia? The way that a lot of these tests are designed is using a statistical procedure called factor analysis. Raymond Cattell, in assessing for 16 factors of personality that he identified, utilized this strategy or this factor analysis technique in order to find clusters of questions that people with similar traits will answer similarly. We're actually going to do an example just to see, or just to kind of hammer this home a little bit. So I want you to think about two things that people who describe themselves outgoing may enjoy. So if I describe myself as being outgoing, what is something that I might enjoy? People who describe themselves as outgoing also tend to say that they like excitement and practical jokes, and they dislike quiet reading. All of these things are statistically correlated in a cluster of behaviors that reflect the trait of extroversion. Okay, so we can we can put items on a test that, asks individuals about practical jokes and quiet reading and excitement and whether or not they're outgoing. And we can notice that there's a group of individuals that answer similarly to all of these statements or all of these activities, and then we can say, well, this group of individuals all has this kind of cluster of behaviors that we would describe as being extroverted. So this is just one way that we're able to, again, if we're coming back to the MMPI-2, we could see that individuals with schizophrenia would answer certain questions all similarly, and same with all of these other, kind of clinical scales. A really good way of memorizing, or remembering, I should say, that the MMPI-2 is used to assess for mental illness is by just looking at MMPI-2. Look at the acronym, and what letters do you see? You see M and I. So just if you think of that M and I standing for mental illness, that'll help you remember what this particular test is used for.